Welcome to this Tuesday's topic on constipation. I am Ashley Anderson, registered dietitian, personal trainer, and owner of Move Fully Nourished, where we specialize in nutrition and exercise coaching using an integrative approach to help active adults achieve optimal health, healing the mind, body, and spirit. Our integrative approach is designed to empower you, as well as transform your lifestyle and relationship with food forever. So, what are we talking about when we talk about constipation? Well, first of all, we're talking about a dysfunction. At least the site of the dysfunction downstream is the GI tract. So your GI tract stands for your gastrointestinal tract and is made up of organs that food and liquids travel through when they're swallowed, digested, absorbed, and then leave the body as feces. These organs include your mouth, your pharynx or your throat, your esophagus, your stomach, your small intestine, large intestine, rectum, and then your anus. The body's GI tract flow, also known as gastrointestinal mobility, that leads to a decrease or halt in bowel movements, is also the presence of an incomplete or malformed bowel movement, is also known as constipation. So people in cultures who eat a normal, whole food diet have at least 1 to 3 easily passed stools per day. There's little, if any, aroma, and there's a medium brownish color. They're complete, long, log-like pieces, or maybe just a few pieces, but most importantly, they come out of the body very readily, especially if we are squatting in order to do a bowel movement or using something called the squatty potty in our conventional world, which is the position that allows for the easiest movement and flow of the stool through the rectum. So constipation can be anything from a true impaction to no movement at all, right? To just less frequency or a hard to pass stool, or maybe pellet-like rock-sized stool pieces, or just incomplete evacuation. There's a huge spectrum, but the intensity and really the effect of the vast majority of individuals in the Western world who have GI issues, it impacts a lot of people. So in the GI tract, we have many different separate cavities that are controlled by different neurotransmitters and hormones. We very often think of the GI tract as being a place where we digest food, right? That's where we digest food. We take it in at the top of the GI tract, we chew it up, we swallow it, it slides down, and it goes into that body blender, and then is churned down into chyme. So that happens in the stomach, which moves then into the intestines, gets bile and enzymes and something called bicarbonate added, and then nutrient absorption starts to happen, and waste products are then isolated, and then your microbes, so in your gut, make up those nutrients. We often focus on just the digestive aspect, but there are many other functions of your GI tract. And another nickname of the GI tract is the gut. So I want to encourage you to think about a broader definition of the role of the gut and the downstream impact of the gut, because in fact, the whole GI tract is actually a very complex world. So rather than thinking of it as just the digestive tract, I want to encourage you to think of it as an exchange portal, essentially a tunnel, right? A tunnel that we're going to imagine here. It's actually a very well guarded and regulated portal that on many levels is actually outside of this systemic body. It's protected by 2/3 of our immune system, by a highly regulated membrane that allows nutrients in and ideally allows nutrients really in and toxins out. And then it has a very selective permeability. So the entire systemic body, aka the millions of cells in your body, they need this gateway for nutrients to fuel cellular metabolism. And we get rid of some waste via our urine and by breathing, and also throughout our skin as we sweat. But the GI tract via our stool is actually where we get rid of the greatest waste and greatest amount of waste products from the body. This includes really not only what we would think of as like poo, right? Things like heavy metal toxins or pesticides or chemical substances that might come in from our food or get absorbed through our skin from personal hygiene products, but also substances that are endogenously produced, so that the body really needs to regulate levels of over time, things like cholesterol, so endogenously inside, and then estrogen or vitamin D. All of these things need to be highly regulated. And so the body also uses the colon as an exit path for excess quantities of a number of biochemical substances. So the next part really is really important. A buildup of those waste products can actually be a true root cause of a disease in the colon. And we'll talk more about this later, but when we are constipated and toxins build up in the body, eventually we begin to reabsorb those toxins and put the burden back on your liver. And again, in the process, you start to reconjugate them all over again, increasing the toxic burden on the body. Your gut is home to more than 2/3 of our immune system, which is constantly surveilling everything, right? That we take in, everything that's on the way out and the way in, it's reacting to and being primed and conditioned by our microbial balance and then lack thereof. And then another key part of the control is our selective permeability. So that's the mucosal membrane. We talked to that tunnel before, and especially in our small intestine. This is where the term leaky gut was coined from, and oftentimes is the true root cause of a lot of our chronic autoimmune activation or diseases. But it's also true that our gut houses its own nervous system. And this is what's known as the enteric nervous system, which generally, actually the vast majority of neurotransmitters in the body are produced here. Neurotransmitters are often referred to as what we call like our body's chemical messengers. They are the molecules used by the nervous system to transit messages, right, play telephone, between the neurons or from the neurons to the muscles. And most people believe like we don't produce the highest amount of neurotransmitters, or that we do produce them in the brain and nervous system, but they're actually produced in the enteric nervous system. So those signals that you get from the body are coming from your gut. This is where nearly about 95% of the body's serotonin is produced, which is a highly important hormone for motility and is the key hormone that stabilizes our mood, our feelings of well-being, our happiness. And the enteric nervous system also is where more than half of our dopamine is generated. And this hormone, dopamine, really plays an important role in how motivated we feel, how we feel pleasure, our cognitive function, our maternal or reproductive behaviors as well. And neurotransmitter imbalance can be a huge driver for motility or dysmotility and constipation. I also want to make sure that you understand that the connection between the brain and the central nervous system and the enteric nervous system is largely mediated with a very interactive large nerve. It's also known as the vagus nerve. So this means that the gut is educating the brain about the status of your world, being highly informed by the microbial population, by the status of food, the nutrient density, the chemical toxins coming in, medications that are coming into the gut, and the brain is getting educated about our world, whether we're living in a safe, secure, nutrient dense place, or whether we are in danger, we're threatened, or nutrient poor space. And of course, the body, oftentimes when it starts to struggle with what we label as disease, is simply just a natural reflection of the fact that the body is under attack. It feels threatened and it's responding accordingly. So when we talk about the site of bowel movements, most of us think right away about the anus or maybe a little bit upstream, in the rectum. But when we think about the notion of the colon overall, which is really where stool is collected and then ultimately it creates its final form and texture, and then peristalsis is that movement needed for expulsion from the body. This is what's happening in terms of forming a stool or not, and then eventually expelling it as a waste product from the body via the rectum. So ultimately, motility, the notion of movement, peristalsis, motility in the body, is about really striking the optimal balance between maximizing absorption, because obviously we want chyme, what comes from the churned, partially digested food from the stomach, to remain in our GI tract long enough to allow optimal absorption of the nutrients, the vitamins, the mineral, phytonutrients, so coming from the colors of plants, but also water. And at the same time, we want to keep that motility optimal so that the toxic exposure, especially in the colon, is minimized. So neither extreme can lead to any known problem, but we know that hypermotility, which can result in diarrhea, for example, or very loose stools, can easily end up causing nutrient deficiency because we don't have enough time to absorb the nutrients. And it can also lead to dehydration But at the same time, chronic constipation on the other end can easily contribute to true disease in the colon itself. And as I was mentioning earlier, be a reflection of disease elsewhere in the body and often an indication of an autoimmune condition. Okay, so what are some of the causes of constipation? I'm going to discuss 15 root causes of constipation today. So 15 causes. The first one we're going to talk about is insufficient magnesium. So let's talk a little bit about magnesium itself. Many of the people that we work with at Move Fully Nourished have insufficient levels of magnesium and actually are truly deficient. But getting nutrients, like nutrition in the body, is not just digesting. So it's about getting it actually into the cell where it can actually do work. And so we often test our clients' magnesium with red blood cell levels, but red blood cell magnesium level, not just serum level. So we want to test interstitial inside the cell. And magnesium can be customized for what people need. There are a lot of different types of magnesium. So the form of magnesium we most often recommend for people who struggle with constipation is citrate, magnesium citrate. And then the second root cause is excessive vitamin D. Too much too fast. This is a hot topic because most people actually are deficient in vitamin D, but when you combine having someone subclinically deficient in magnesium with high doses of vitamin D, what you're going to get is constipation. So you're going to get symptoms of magnesium deficiency because the body has to use magnesium to convert vitamin D into the final form that the body is actually taking up into vitamin D receptors. And this is the case of vitamin D, whether it's actually made from the body via sunlight, like if you're outside, or whether it's taken in supplemental form. So if someone is already deficient or insufficient in magnesium, and they start taking a high dose of vitamin D, and they suddenly start having symptoms of constipation kind of associated with the high levels of vitamin D, those will almost always be associated with either the hormonal effects of vitamin D, such as too much, and can also promote hot flashes or late perimenopausal or menopausal in women, or also associated with symptoms of low magnesium. So it's very important to consider magnesium needs first before adding in a vitamin D supplement, especially if it's going to be a significant dose. And when I mean significant, I mean anything 2,000 IUs or more. So people who start taking 2,000 IUs of vitamin D3 and then within a few days start to experience notable symptoms, maybe constipation or hot flashes, which are likely associated, again, just with insufficient magnesium. The third root cause is of excessive calcium intake and electrolyte imbalance. So electrolytes are potassium, magnesium, calcium. These are critical. Too much calcium, and again, not enough magnesium, and not enough potassium, especially for people who aren't consuming enough plant foods, especially vegetables and fruits and color diversity. Magnesium is a powerful, really driving motility force because magnesium is a master electrolyte that allows more potassium to get into the cell and have that cellular effect to really promote optimal muscle contraction and then relaxation. So excessive calcium overpowers the effects of magnesium and then can lead to this motility. Fourth root cause would be insulin resistance and hyperglycemia, also known as high blood sugar. So individuals who have evidence of peripheral neuropathy, so which is a very common side effect of type 2 diabetes, because again, of the oxidative damage to our nerves because of the high sugar content in the blood. That's the pathway, by the way, that which type 2 diabetes really wreaks havoc on our kidneys and our eyes and our nerves, the lining of our arteries. And it's really via the oxidative damage that's occurring. And then the nervous system is vulnerable to that. And so if you have type 2 diabetes and also a struggle with other types of peripheral neuropathy, like numbness or tingling, think about the possibility of autonomic neuropathy. So the most commonly prescribed medication for type 2 diabetes is metformin. And metformin is a great drug in terms of actually improving insulin sensitivity. However, metformin also has a known risk of depleting vitamin B12. And low vitamin B12 is also a common cause of neuropathy. So there can be an unfortunate catch-22 here. The fifth root cause is a hypothyroid state. So when a person goes to their doctor's office, they often will have their thyroid tested, especially if they're complaining of being fatigued or stressed, and they're screened typically just for TSH levels, which is a shame because you can have a perfectly optimal TSH, and you can even have a perfectly optimal T4 and free T4. But when you actually start looking at T3 and low T3 and reverse T3, individuals can have poor conversion of T3 to T4 hormone, which is really creating an insignificancy in the thyroid gland. Is actually not really done there. It's done in the liver and the kidneys and other tissues, but this poor conversion is really at the root cause of a ton of people who have obvious signs of hypothyroidism. So they're being told that they're fine based on an insufficient lab assessment. So when we test our clients at Move Fully Nourished for thyroid issues, we do a full thyroid panel, which includes all the hormones produced by the thyroid and any antibodies that are present indicating an autoimmune condition, plus those then that are in the reverse and halt of the process too. Okay, number 6, the 6th root cause of constipation, adrenal dysfunction. So high cortisol, high reverse T3, or low cortisol. So adrenal dysfunction, so we know that high levels of cortisol can promote a conversion of T4, so that's that thyroid hormone, into something called reverse T3, which is an inactive downstream metabolite that fills receptors and then keeps T3 from being taken up by receptors. And then of course, it's always preventing the T4 conversion to T3, but it's also in true sustained stress. Like when people have adrenal fatigue, it can lead to low cortisol as the body moves into a self-preservation mode and really starts to drop cortisol down so that we stop suffering from all the ill effects of the high cortisol. We need enough cortisol to actually allow the uptake of our thyroid hormones into the cells. So either a high cortisol or a low cortisol state can drive hypothyroid function and contribute to constipation. That's a dense topic. Okay, number 7 is insufficient serotonin synthesis. So insufficient serotonin synthesis is another cause of constipation. As we talked about before, the enteric nervous system is where 95% of the body's serotonin is produced. And we talked about this really when we were talking about the gut motility. It's actually the most important neurotransmitter for motility. And excess production of serotonin, so too much in the gut, often leads to diarrhea. Insufficient serotonin creation often leads to constipation. You can see the two double-edged sword. The 8th root cause is SIBO. Causes of SIBO constipation or diarrhea is because too much hydrogen production in the intestine promotes lots of serotonin. So it can, again, promote diarrhea, or too much methane production in the intestine impairs or blocks serotonin production, which causes a sluggish motility and then constipation. So a great example of how our behavior affects the microbes in our body. The microbes are affected by the hormones, and then neurotransmitters, like those chemical messengers we talked about before, affect our motility. So let's say, for example, clients who are using an SSRI medication, like it's called selective serotonin reuptake inhibitor. And these medications are widely used as antidepressants. So for individuals who actually have low serotonin function, which can often be uncommon in individuals who have been given these drugs, but when they truly do have a low serotonin function, taking an SSRI promotes more serotonin activity, and they will experience improvement, for example, in constipation at first. But it's also true that the longer that people use these drugs, it ends up actually depleting the very hormone whose action it's trying to create, the serotonin. And so ongoing use of something like an SSRI or an antidepressant can actually create constipation simply due to serotonin depletion in the enteric nervous system. Crazy, right? To think about it, it's like almost like you're adding it in, but then your body is downregulating it because you're taking it. The 9th cause is dysbiosis. That's an imbalance in the bacteria in your gut. Simply having an imbalance can be a problem. So as we age, constipation becomes more common, especially because in elderly populations are much more likely to have low counts of a specific type of bacteria called bifidobacteria. And so probiotics that are high in bifidobacteria, or even just a type of like a bifidobacteria, can help be a great probiotic solution to constipation. So especially if like the constipation is coming after use of an antibiotic. Number 10, the 10th root cause of constipation is food sensitivities. So food sensitivities can lead to constipation, especially dairy. This is really a simple solution. If you eliminate all forms of dairy, you see how you feel, you experiment with it. An awful lot of nations in the world do not consume dairy products in their entire lives. they still have strong bones, and they're still Olympic competitors. Dairy is not a necessary food. It's just not. Some people may thrive on it, but many people do not. And often we see that in our practice. But on the other side, lactose intolerance is a dairy protein that's sensitive to the immune system, usually by an IgG, and to a lesser degree IgA activation. And that talks about like the reactivity, the inflammatory response that we have in the proteins in dairy. And most often casein or whey, those are the other types of proteins, the lactose would be the sugar, and they promote constipation. It's a type of inflammation that can really be delayed. You can eat something and then 48 hours later, after the food has been taken in, then have a reaction to. So it's very difficult for people to determine what they're sensitive to, but dairy and gluten sensitivity are extremely common. See it all the time. And that's because low-grade enhanced intestinal permeability is very common. Most of us have trashed our brush border, and courtesy of the pesticides and artificial sweeteners and medications and over-the-counter painkillers. And so the enzymes that would help us even partially digest gluten and dairy in the brush border aren't there. And then when we have that damaged brush border, we really don't digest those foods well. And then the combination of the damaged brush border plus the intestinal permeability, so things leaking and seeking through, that means the immune system gets too much exposure to these maldigested foods, and it flags them as like a foreign invader, as a potential threat. And then the person has a food sensitivity or a reaction to it. And it's really important to understand this because it's not just in the spirit of constipation, but in the sense of really all other sorts of dynamics when we're talking about anger management issues, to attention deficit disorder, to arthritis, to liver issues. They can all be impacted by food sensitivities. Root cause number 11, sympathetic dominance. Now we talked about this a little bit before, but the automatic nervous system and the vagus nerve. The automatic nervous system, which controls the activities that you do without even thinking about them, is made up of our sympathetic nervous system and our parasympathetic nervous system and our enteric nervous system. Two parts. The automatic nervous system is in charge of everything that happens in the GI tract from the throat down, because the only part in digestion that we have control over is really chewing and swallowing, which is why eating hygiene and good chewing and relaxing environment, these are all super important concepts, not only for digestion, but for the health of our entire GI tract. So if we are living in what we call a sympathetic dominant state, a lot of fight and flight stress, then it's perfectly normal for there to be a dysmotility, lack of movement in the gut. Not because anything's broken, but because the sympathetic nervous system is being activated. And the nervous system mode does not favor digestion or motility at that time. It's perfectly normal for one to have maldigestion, malabsorption, and dysmotility when one is in a fight or flight state. Stressed. So this is because if you have to fight for your life or you're fighting and flighting, the body is not interested in digesting or having sex or being fertile. So if any of these other things that people expect to have when they're living in a very stressful life, it's not going to happen. The body is fully capable of going into fight or flight mode and saving itself, but that's intended to be the less common nervous system state. So it is really important to not joke about your stress and actually do something about it, because I'm amazed at how oftentimes, this is really the downstreams effects of motility and digestive secretions and thyroid function and cortisol levels. And it has a huge impact on so many of the people that come to us and many functions in the body, including motility. And another really important thing to note here is about eating hygiene. So eating hygiene is very important for people to prioritize this in order to engage the parasympathetic nervous system, that rest, digest. And this helps us optimize digestion, optimize absorption, optimize motility. And for a person who has SIBO or who has GI dysfunction or dysmotility, it is so important not to graze on foods throughout the day and to really give your body a break. It's called the migrating motor complex, the MMC, a chance to work. You need that to work between meals. It's critical. And when we are digesting food, the MMC doesn't work. So the body does not digest and cleanse at the same time. It's going to do one or the other. So give yourself at least 3 to 4 hours between meals. Okay, root cause number 12. Let's talk a little bit about sex hormones. So for example, excessive progesterone. For those who are pregnant, and struggle with constipation, largely because you've got high levels of progesterone, which is, of course, protective to the fetus. But it can cause imbalances. Or if you're perimenopausal or postmenopausal, or you're using progesterone as a supplement to get better hormone balance. But if it's too much progesterone, that can be a very direct driver of constipation. Root cause number 13. Two of the most obvious and easily modified root causes of constipation are insufficient water or fiber. Dehydration is a big issue. Most clients we work with have subclinical dehydration. It is also a big myth that the optimal level of water is 8 glasses a day. It's widely talked about, but there's no scientific evidence behind it. Someone just made it up, it sounded good. But when we look at specific recommendations per individual, we tell our clients to get at least 50% of their body weight in ounces. So if a person weighs 170 pounds, they should aim for at least 85 ounces of water per day. And people who eat a lot of processed foods or a lot of diuretic foods like black tea and coffee, especially if it's intermittent, it's the irregular intake of those drinks that can actually be an issue. Like alcohol is always a diuretic. So if these are things that you want to think about that might be contributing, and certainly the number one place I would start in terms of trying to address your constipation. In terms of fiber, it's also important to understand the kind of fiber you need. So we need soluble and insoluble fiber. Soluble absorbs water and can bulk up a stool and make a stool soft so that it's easier to pass. Insoluble fiber helps to move the stool along. So depending on whether a person has constipation that looks more like it's incomplete, kind of watery bowel movements, or whether someone's literally just not passing a stool at all, that type of fiber that the person will actually need can vary. Another form of fiber I want to talk about, psyllium husk can be a great remedy for people too. Psyllium husk has a little bit of both kinds of fiber. It can be a really good source of soluble fiber in particular, but too much too fast can create a lot of IBS symptoms, so irritable bowel. And psyllium husks are definitely contraindicated for anybody who is already struggling with IBS symptoms. So not somebody who we're trying to get things moving along here, because it can cause cramping and abdominal distension. But I want you to be aware that an awful lot of fiber supplements out there for looking at brands bring in a lot of crap. Like a lot of potentially inflammatory additives, potential food sensitivities, artificial sweeteners, artificial colors, artificial preservatives, artificial flavors. So obviously these things are not necessary. It is not necessary for our fiber supplement to taste like an orange or be orange in color or have the consistency of milk. We just don't need that. And while in terms of a one-time triage of things, we're really just wanting to get down to it, there's a lot of myths out there when it comes to dried fruit that improves motility. I want to tell you a little bit of, it's not always true for a lot of people. Any kind of dried fruit can actually make it worse. Prunes specifically work not because they're high in fiber, they work because they're high in sugar alcohol, which are of course contraindicated for people who have SIBO. But for others with constipation, a few prunes can be effective in that way. Also, xylitol is also a sugar alcohol. It also tastes quite sweet on its own. You can buy it when you buy mints or chewing gum. You can see xylitol on the back of the package. So chewing gum can actually often be a recommendation for constipation because the act of chewing actually stimulates motility, and it can be used for more mild cases. I'm not talking about long-term constipation here. And then the 14th root cause of constipation is insufficient dietary fat. If you were going to lubricate something like your plumbing in your home, you actually wouldn't use water, right? Water's only of value because it helps to bulk up the stool and because of soluble fiber. But what will lubricate the stool is fat. There are essential fats we do need from our diet. We can't make them on our own, but whether people choose to eat, small amount of fat or medium amount of fat, it's just important for lubricating your stool. So for example, olive oil. Olive oil promotes peristalsis, so movement of the stool. In particular, it promotes contraction and emptying of the gallbladder, which then also stimulates motility downstream. And that's really because of the polyphenol content in olive oil. It's not necessarily because it is a high-fat food, but olive oil is loaded with polyphenols. It's actually kind of similar to how coffee stimulates motility. If you drink a glass of coffee and then run to the bathroom afterward, it's got polyphenol content in it. It's not necessarily the caffeine. Well, caffeine can contribute to it a little bit, but it's really the polyphenol. Anyways, the last thing that I'm going to talk about is the 15-month common cause of constipation is medications. So there's a lot of medications that are prescribed in this world, and there are things that are largely to soften stools or promote motility by forcing more water into the colon, or by forcing hypercontraction or the muscles in the intestines in order to artificially stimulate peristalsis movement. So these can be absolutely necessary in acute situations where someone is impacted, but there are downsides to a lot of drugs that are taken, and they are not intended to be long-term resolution or get to the root cause. Medications have their place in our world, but they are highly overused in today's world. They're overprescribed. They're often regarded as the first line of treatment rather than an emergency triage or the last resort in order to create more stability so that a person can work on their lifestyle, or they can get enough stability to work on their lifestyle or create enough really stability biochemically in the body so that you have enough time to work on the root causes, true root causes. If you are ready to find your solution and put your constipation days behind you, we'd love to help you find your root cause and address it using an integrative approach, achieving optimal health, healing your mind, body, and spirit. And as I said before, our integrative approach at Move Fully Nourished is designed to empower you, as well as transform your lifestyle and relationship with food forever. If you go to movefullynourished.com and click on Apply Now, you can fill out our short coaching application, and you'll be contacted to schedule a complimentary discovery call to see if you'd be a best fit for our nutrition coaching program. Thank you so much for listening to this presentation and being curious about finding a solution to your constipation, because your life depends on it. Have a fantastic rest of your day.